Communication between allied health teams can prove to be a challenge. Information may be misunderstood, heard incorrectly, or missed completely. All clinical fields have their own ways and methods of communicating together, making it potentially difficult for effective interprofessional communication, especially for novice practitioners. It is therefore essential to master the skill of communication in regard to interprofessionalism, and more specifically, for me to master it in the pre-hospital setting for my future as a graduate paramedic. The long-anticipated transition from student to novice practitioner will be an exciting and also terrifying journey. Most of the skills that I've been taught at university the last 4 years will be utilised and practiced every day, and interprofessional communication is a vital skill that will need to be mastered. Communication is a skill that cannot be entirely taught in the classroom. Basic principles and acronyms may be taught, but when it comes to delivering a handover, for example, the information varies and changes vastly from patient to patient. Certain information may need to be extracted from a case and delivered in order of significance to ensure it is not missed and followed up appropriately. Paramedics communicate with a number of different health teams, ranging from doctors to nurses, other paramedics, triage staff, and virtually any health team in a hospital. Paramedics retrieve patients from many wards within health facilities and thus need to master the skill of interprofessional communication, as every profession practices differently. During my time at university, I have had the opportunity to practice communication during scenarios. Makeshift handovers were conducted to tutors who pretended to be allied health personnel at hospitals. In addition to this, I have extensively practiced handover and communication with allied health on clinical placements. As placements are only for a short period of time, I feel as though it was not enough time to master this skill. This was one part of my practice where I struggled more than anywhere else, particularly on my first placement. I was able to use the acronym IMIST-AMBO to write down my handover of my patient. However, when it came to delivering that handover, it had escaped my mind completely. I had started to hand over information that was irrelevant and provided facts about my patient in the wrong order. I had also failed to understand the difference between triage handover and bedside handover. The handover to the triage nurse should be relatively short and concise, highlighting the key aspects of the case and the severity of the patient's presentation. The nurse's role is to categorize the patient according to a triage score based on their clinical urgency and will determine the treatment pathway for the patient. Shaban and Considine, 2011. Thus, bombarding the triage nurse with the entire handover can result in error, as they are not concerned with the entire assessment and story. My second and third placements is where I showed significant improvement during my handover and general communication with allied health staff. I had made this my main focus for improvement and highlighted this area of struggle to my mentors, who had in fact supported me significantly. Communicating my areas for improvement to my mentors ensured that my goals were being achieved and exhibited that I was actively and positively engaged in my learning. This teacher-to-student communication is also a vital aspect, as it creates positive professional relationships and ensures that I was able to gain the most from my learning opportunities on placement. There have also been instances where I delivered my handover to the triage nurse. However, nothing was documented. The nurse would then question my mentor for an almost identical handover and disregard the information I had delivered. This has highlighted to me that perhaps some qualified staff have difficulty finding the patience to listen to students and provide support during struggles. Interprofessional communication plays a fundamental role in healthcare of a patient. Commonly, not a single person or a single health team treats a patient that has arrived via ambulance to a hospital or health facility. It is a collaborative process with multiple disciplines in health, and thus requires effective communication between teams to ensure the best management of patients and to avoid the occurrence of medical errors. Keller, Eggenberger, Belkowitz, Saskaveyak, and Zito, 2013. The study conducted by Hustov et al. 2018 identified that a healthcare team functions as a team more effectively when communication is at its highest quality and as a result allows for the highest quality healthcare. Once a patient arrives at hospital, the staff are unaware of the patient's condition unless otherwise pre-notified. It is of utmost importance to provide an accurate account of events for the treating staff to conduct accurate assessments and triage appropriately. This process determines which level of care the patient receives as well as the urgency of care. Shaban and Considine, 2011. The team receiving the information from paramedics rely heavily on what treatments and assessments were conducted in the pre-hospital environment, as paramedics are the first health professionals on scene to the initial incident. This information also prevents possible drug reactions and overdoses, as the team is aware of what treatments were given to the patient. Accurate documentation is similarly significant. However, the initial verbal handover of care is paramount. A handover is not limited to information transfer, but is also handover of care. The responsibility and duty of care of the patient and their health is being transferred from one team to another, and thus requires immediate and accurate communication to facilitate that transfer. Shaban and Considine, 2011. Despite all efforts to provide effective interprofessional communication, some barriers may exist to hinder this process. Each health team has different approaches to health and also has different training styles and experiences. This can create a lack of trust and respect in other professions due to their own professional exposure and competence. O'Daniel and Rosenstein, 2008. There may be a difference of opinion in treatment or presenting issue. However, it is vital to consider these differences in professions and recognize that healthcare is a collaborative process. There may also be a presence of power differentials due to factors such as personality, experience, or authority. Keller et al., 2013. In addition to this, when communicating with another health professional, they must be in a position ready to receive the information. An emergency department can be a busy and frantic environment with many distractions. Triage nurses, doctors, and other staff can have multiple tasks to do at the one time, which creates opportunities for information to be misunderstood or missed entirely. As a paramedic, it is vital to be patient and understand that this may happen. It also creates the responsibility to advocate for the patient and ensure that the handover is given at an appropriate time, as the patient is still in your duty of care. Lee et al., 2008. During my transition from student to novice practitioner, the responsibility and autonomy increases tremendously. I will have to hand over all of my patients and communicate on a professional level with many health teams. To prepare myself for this transition and ensure my communication skills improve, there are a number of strategies that I can adapt. According to the World Health Organization 2010, having a thorough understanding of the roles of health teams will improve interprofessional communication. This can be achieved through interprofessional education. As I am studying both nursing and paramedics, I have already begun this process by adapting two professions into my practice. I was able to improve on my handover and communication skills on placement by attending nursing placements, as well as integrating skills from both professions. In my future as a qualified paramedic, there are many free courses available for health professionals to attend to further educate and improve practice. This can also involve attending courses not relevant solely to paramedics, but other aspects of health also. Having interprofessional education will lead to collaboration of teams and, as a result, positive, effective interprofessional communication. World Health Organization, 2010. The article written by Hustoff et al., 2018, reported that poor communication skills contributed largely to ineffective interprofessional communication. As I have had previous struggles with this, it is imperative that I continue to develop this skill and adapt further strategies to assist in this. One strategy includes continuing the use of the acronym IMIST-AMBO, or any acronym that works well for me. Hustoff et al. 2018 and Marshall, Harrison, and Flanagan 2009 reported that the use of a communication tool or written procedure significantly improves communication and transfer of information by providing clarity and structure that will eventually become second nature. The continued use of a structured tool will allow me to practice handing over a variety of cases and adapt it to suit any case. In addition to the use of a structured tool, practice and experience will be the most effective in improving my interprofessional communication as a newly qualified paramedic. There is a limit to what universities are able to teach students, and the rest is hands-on, experiential learning that will come with time and exposure. Keller et al. 2013 reported that experience gained through time allows for development of confidence and professional relationships. Getting to know interprofessional teams and colleagues through continuous exposure will allow me to become familiar with how they work and how they like to receive information about patients. This will also aid in disabling the barriers of power, differences of opinion, and lack of trust. O'Daniel and Rosenstein 2008 suggest to having an open, positive attitude along with patience and respect to eliminate these barriers in time. Adapting certain communication styles, such as assertive language and displaying confidence through body language, will also aid in eliminating these barriers and in turn improve communication skills. Hazelwood and Shakespeare Finch 2014. I am optimistic that my interprofessional communication skills will improve and flourish as a novice practitioner, and I am incredibly eager to begin the process of shaping my own practice and future as a paramedic.